Good morning. We'll take today maternal pelvis. Good morning. We'll start with the maternal pelvis. The pelvis is consisting of four bones and four joints. There are the two innominate bones. There is a sacrum and there is coccyx, and this is the coccyx. So these are the four bones. The four joints are the pubic symphysis, two sacroiliac articulation, and one sacrococcyx joint. So this all together form the maternal pelvis. Now, how you hold the maternal pelvis in anatomical positions? If the anterior superior iliac spine and the pubic tubercle both are kept in one plane, then this will be the vertical position. So if both are touching the surface, then vertical plane, this is pubic, this is the anatomical position of inlet of the pelvis. It is tilted forwards. So that is the anatomical position. Now we go to what is a true pelvis and what is false pelvis. So true pelvis, by an imaginary plane at the level of the inlet of the pelvis is divided into false pelvis and true pelvis. This is the imaginary line of the inlet of the pelvis. So that part of the pelvis, so this part which is lying above the inlet is a false pelvis. This is bounded posteriorly by the lumbar spine. Laterally there is the flare of the ila, and anteriorly it's the abdominal wall. Bony component is deficient. Now the false pelvis is not related to the process of labor. It's only that the uterus rests on the flare. We are mostly concerned with what is the true pelvis. Now, what is true pelvis? When we talk of true pelvis, the part of the pelvis which is below the inlet of the pelvis. So, all the part which is below this line till here, this is all concerned with the process of labor. This is anteriorly around 5 centimeters in length and posteriorly it is 12 centimeters. You can see anteriorly the bony component is pubic symphysis and this length is around 5 centimeters, and posteriorly from the sacral promontory to the tip of the coccyx, this is all the posterior wall and this is around 12 centimeters. Now the lateral part is formed by the ischial bones, by the sacral tuberosity, ischial spine and the ligaments. This is the part which is actually concerned with the process of the labor. Now, in order to study the true pelvis, we divide it into a few components. First is the inlet of the pelvis, then the cavity of the pelvis and the outlet of the pelvis. First, coming to the inlet. In the inlet, first we define the boundaries of the inlet of the pelvis. Now, what are the boundaries? The boundaries are starting from anterior to posterior. There is the pubic symphysis, pubic crest, pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac articulations, ala of the sacrum, sacral promontory, and the same structures on the opposite side. This constitutes what is called as the inlet of the pelvis. Now, this is one of the most important parts which each person should know. As a student, you must always remember the boundaries of the inlet. Now, coming to the inlet, we have certain diameters which are concerned with the inlet. One is the anterior posterior diameter of inlet. This is the anatomical conjugate. It starts from the upper border of the pubic symphysis and posteriorly it is center of the sacral promontory. So something like this. This is called as the anatomical conjugate, and this is only of anatomical importance. It is also called as the true conjugate. Next diameter is the obstetric conjugate. This was true conjugate. Now obstetric conjugate is from the posterior surface of the pubic symphysis in front to the same point posterior. That is somewhere like it is going from the center of the pubic symphysis and reaching to the sacral promontory in the center. This is obstetric conjugate. Now this is one of the most important diameters. The reason being that this is the narrowest diameter of the pelvis, and this is very important in the process of the delivery of the fetus, and this is 10 centimeters in length, and this is the shortest diameter of the pelvis. Next comes the diagonal conjugate. The diagonal conjugate is from lower border of the pubic symphysis in front to the same point, that is center of the sacral promontory posteriorly. So this is from lower border of pubic symphysis to center of the sacral promontory. This is diagonal conjugate. Now the diagonal conjugate, how it is measured? The diagonal conjugate is measured, it is the only diameter which can be measured clinically, and it is measured by introducing the fingers into the pelvis and trying to reach for the sacral promontory. The obstetrician, after trying to reach for the sacral promontory, tries to pull the finger and then measure the height, measure the length from the tip of the finger to the point where you have made a mark. This is the diagonal conjugate. Now from the diagonal conjugate, if 1.5 to 2 centimeter is deducted, then you can deduce the obstetric conjugate. So the diagonal conjugate is used in order to determine the obstetric conjugate. So this is of clinical importance to deduct the narrowest diameter. Now what are the various diameters of the inlet of the pelvis? The anterior posterior diameter, what we had already spoken, this is from the anatomical conjugate is 11 centimeters. The obstetric conjugate from the nearest point to again this is 10 centimeters, and from lower border of pubic symphysis to this is 12 centimeters. So when you subtract 1.5 from 12, you get 10.5 or 2 centimeters. So if you subtract 1.5 to 2 centimeters from this diagonal conjugate, you will get the obstetrical conjugate. That was about the inlet of the pelvis. Then, as we have already spoken, that the pelvis is making a tilt with the horizontal. So if we join this inlet and pubic symphysis, you will see that it makes an angle, and this makes an angle of around 55 degrees with the horizontal. So you can see that the scale is making an angle of 45 degrees with this plate. Now this is what is the importance now. If you draw, suppose this is the inlet, the axis of the inlet. If you draw a perpendicular, that is if you draw a right angle at this is the axis of the inlet, and it is this axis through which the fetus enters into the inlet of the pelvis. Now there is, we have spoken that this is normally inclined at 55 degrees. There is one term called as the high inclination of the pelvis. At times in some women, the fifth lumbar vertebra gets stuck to the sacrum. This is called as the sacralization of the lumbar vertebra. So the sacrum becomes a little more big by one segment. So the angle also becomes high. So high inclination, when it occurs, it means the inclination is not at this level, it may be something at this level. So high inclination will interfere with the engagement of the head of the fetus. That was all about the inlet of the pelvis. We'll again go to the second part. As you already know that this is the various points which is defining the inlet of the pelvis. This is how the measurement of the diagonal conjugate, this is as it appears, it is from your book. Now, there was one erratum, it was not 45, it was 55 degrees. So, the axis is when you join the upper border of the sacral promontory and the pubic symphysis to the horizontal, that is to the line, this makes an angle of 45 degrees. So, the pelvis is tilted at 55 degrees. Now, we'll again go to the next part. Now we'll go to the planes of the pelvis. First plane we had already spoken of, and that was inlet of the pelvis. Then now we'll go to the pelvic cavity, that is the plane of greatest pelvic dimension. The pelvic cavity is the roomiest part of the pelvis. Now this is the roomiest part of the pelvis. It is bounded anteriorly by the pubic symphysis, posteriorly by the second and third pieces of the vertebra, and laterally bounded by the acetabulum part of the ischial bone. Now, if we talk of the plane of the greatest pelvic diameter, then anteriorly it is bounded by the middle of posterior surface of pubic symphysis, posteriorly by the junction of second to third sacral vertebra, and laterally by the bone, that is the acetabular part of the bone of ischium. So this is the level of the great pelvic dimension, which means that this is the part which will be the greatest part for the fetus to have roomiest, or what is called as the roomiest part of the pelvis. This will be something like at the level where the pink part you can see. So the junction of the second and third, laterally it is touching the acetabular part of the bone, and anteriorly the posterior part of the pubic symphysis. Then we go to the next plane that is of most importance, that is the narrow pelvic plane. Narrow pelvic plane is at the level of ischial spine. So if you can see ischial spine, it is at this level, that is at the level of the ischial spine is the narrow pelvic plane. So this is forming, there is a term later on we will be coming, like what is the obstetrical outlet. When we talk of obstetrical outlet, it is bounded above by narrow pelvic plane and below by anatomical outlet. So first we will be describing what is narrow pelvic plane and what are the boundaries, and then we will go to the anatomical outlet. It is important, it is at this level. If I just show you, so this is at the level of ischial spine, and posteriorly the last piece of the sacrum, and anteriorly lower border of pubic symphysis. So somehow this is the level inside the pelvis, if you can visualize. So the last piece of the sacrum posteriorly, laterally the acetabular, the last piece of the sacrum here, laterally on the level of the ischial spine. Now can you all see? So at the level of the ischial spine here, and anteriorly lower border of pubic symphysis. So that is the level of the narrow pelvic plane. Now what is the importance of the narrow pelvic plane? To name them, the narrow pelvic plane is the part from here all there is the origin of the levator ani muscle. This is a part where the fetus undergoes internal. Now as the fetal head enters into the pelvis, and once it reaches the level of the ischial spine, that the rotation occurs, and the head rotates through 1/8 of the circle. This is a point where there is a resistance and the maximum flexion of the head occurs. We call at the level of narrow pelvic plane as station 0. So when we talk of station of the head, where the head is placed, and we say it is station 0, it means it is at the level of the ischial spine. The biparietal diameter is at the level of ischial spine. Then at the tip of the ischial spine, hooks the nerve, pudendal nerve, and this is used as a landmark for giving pudendal block. This is the level where the external os is normally situated. So when we describe of that the cervix has descended, then it is with this landmark that we call that the cervix has prolapsed. So this is in gynecological patients. So that is the importance of narrow pelvic plane. Now coming to the diameters of the narrow pelvic plane or the outlet, we are having two diameters. One is the interspinous diameter and the other is anterior-posterior. So the interspinous diameter is 10.5 centimeters. This is again the narrowest part of the pelvis. And the anterior-posterior diameter is 11.5 from the lower border of pubic symphysis to the tip of the last sacral vertebra. So that was about the anteroposterior diameters and the transverse diameter of the narrow pelvic plane. Now we go to the outlet of the pelvis. The outlet of the pelvis, the anatomical outlet of the pelvis, that is consisting of, if we go from anterior to posterior, lower border pubic symphysis, rami, ischial tuberosity, then there is the sacrotuberous ligament, and the bony component is the tip of the coccyx, and the same structures on the opposite side. This is the anatomical boundary, and the anatomical boundary is partly bony and partly ligamentous. And if you can see that this is not a round space, this is a diamond shaped space, and by an imaginary line at the level of ischial tuberosities, it is divided into two triangles. The anterior triangle is called as urogenital triangle and the posterior triangle is the anal triangle. And coming to the diameters of the outlet, the anterior-posterior diameter from the lower border of the pubic symphysis to the tip of the coccyx, this is 10.5 centimeters, and in second stage of labor it goes to around 13 centimeters, and the transverse diameter is 11 centimeters. So now you have the transverse diameter is, one is the interspinous, other is the intertuberous, and then in the anatomical it is, one is anterior posterior of the anatomical outlet and anterior posterior of the obstetric. Now what is obstetric outlet? When we talk of obstetrical outlet, when you are asked, then the obstetrical outlet is not a plane. It is a segment of the bone. Now I'm trying to just define for you all so that you can appreciate the segment. Now this is the level of the narrow pelvic plane. Here if you can see the narrow pelvic plane at the level of this pink paper, and this is all the last part, that is the tip of the ischial spine, the tip of the tuberosities, and now we'll go to the planes of. So now you know that why the least pelvic dimension or the narrow pelvic plane is very important, and these are all the points under which we describe the importance of the narrow pelvic plane. This is axis of the pelvis, as we'll be touching upon. There is inlet, this is cavity, and this is outlet. So if you draw a perpendicular on this, above it reaches the umbilicus and below this axis reaches the tip of the coccyx. This is the line. Then if you join lower border of pubic symphysis and the tip of the coccyx and then drop a perpendicular on this, this is the axis of outlet. And in between the two, if you join another line, that is axis of the cavity, and if all three are joined, it forms a curve. This is the anatomical axis of the pelvis, this has no obstetrical significance. Then here on your right you can see that there is another diagram in which the line moves downwards and backwards till the time it has reached ischial spine, and then it moves downwards and forwards. This is the axis of the obstetrical axis, as it is called, the direction along which the fetus moves. Now we'll go through what is pelvic axis. When we talk of pelvic axis, there are two axes which are defined. One is anatomical axis and the other is obstetrical axis. Anatomical axis means like you have got inlet, you have got cavity, and you have got anatomical outlet. If you would drop a perpendicular in each of these, that is in the inlet if you draw a perpendicular, in the cavity if you draw a perpendicular, and in the outlet if you drop a perpendicular, and if you join all the three, it will form a curve through which the fetus, it will form a curve. This is the anatomical curve of Caris and it is curved. Whereas the obstetrical axis means the direction along which the fetus delivers. So for that, if this is a fetus, then the fetus normally enters at an axis, that is, it will enter at right angle to the inlet and it will go up till the cavity, up till the ischial spine. There it will rotate and then it delivers out by one curve. So the obstetrical axis is to go, that is, the head moves straight up till the ischial spine, and from the ischial spine there is a curve which comes anteriorly. So you can appreciate that this is a curve which is moving straight up till the ischial spine, and from ischial spine it is moving forwards. So the blue one is telling that there is a forward curve and this is downwards and backwards. So that is how is the curve of obstetrical axis. Now one part is pubic angle. The pubic angle is clinically measured. It is a space in between the two rami of the pubis. Normally this is measured by keeping thumb on one side and the other fingers on the opposite side. So you can see that there is an angle between these two. So this angle which is formed in between them is normally more than 85 degrees. So when it is more than 85 degrees and when the fetus delivers, normally like you can see that there is very less space in between the head. So when this is delivering, the amount of the space in between both of these, this is negligible. You can see that this is almost negligible space in between the pubic symphysis and the skull. This is less than 1 centimeter space. So here there is no way space of Morris. Suppose if this pelvis was narrow and this angle becomes more narrow, then the space available will be less. And if the space in between the head and, say if this is the situation, the space in between, now the space in between the lower border of the pubic symphysis and the head is like more than 1 centimeter, then you will be saying that this space is called as the waist space of Morris, and when this space increases, then there are difficulties in the labor is prolonged, and sometimes it may be a persistent position for the head and delay because of the narrow space available. So that was all about. So now you will know this. I feel you could have understood pelvis to some extent. Thank you.